Hello and welcome to this edition of Your Health, Your Wealth. I'm your host, Eddie Patton, and glad to be here with you. I want to continue along the lines of conversations we've had about dementia and Alzheimer's. And I want to clear up some things because nowadays when people hear dementia or cognitive impairment, they automatically think of Alzheimer's disease. But I think it's important to level set and think about this from the standpoint that the term dementia, which I don't even use the term really anymore because it has become a term that's been automatically associated with Alzheimer's disease. But the important thing is that this is just a group of symptoms, and there are other things that can cause memory loss, cognitive impairment, or dementia other than Alzheimer's disease. So I want to touch base on that today. Not all memory loss, not every cognitive impairment disease is Alzheimer's disease. And so we'll talk about some other causes and so forth. Now, the reason why this is so important is because as we are in this new era, this new age of treatment for cognitive impairment or dementia, with these new anti-amyloid therapies and different things like that. One, it's important to make the diagnosis, and it has to be the correct diagnosis. And so making sure we understand what are some of the differences between the different types of memory loss. So a couple of terms I'm going to use throughout this talk that I want to make sure everyone understands. Dementia is actually an umbrella term for a group of symptoms, and there are several different diseases that cause dementia, Alzheimer's being number one. The term that I use now is cognitive impairment. Cognitive is like memory impairment or thinking. And when we think about cognitive impairment, we all have times when we are distracted or forget things. Maybe I don't remember where I placed my keys, or in a previous episode, I talked about being distracted once, and I actually threw my keys in the garbage can outside, and I thought I lost them, and then finally, once things slowed down, I remembered and went and checked the garbage can and found them. But the point I'm making there is that I don't have, at least I don't think I have, a neurodegenerative process like Alzheimer's, but I did have a moment of cognitive impairment because I was distracted. I was stressed and I was doing a lot of things. And so, cognitive impairment or memory loss happens to everyone, but it's when it interferes with your what's called activities of daily living. Things like paying bills, things like remembering appointments, conversations. When it starts really interfering with your daily life is when it becomes, pathological. When we really look a little deeper into what's the cause of this, and maybe this isn't normal memory loss of aging and so forth. So when we think about memory loss or cognitive impairment, there's usually several categories, and the first one being what's called normal memory loss of aging, meaning that, everyone forgets things, as we just talked about. And as we get older, you may not have as good as memory as you did years ago. And that's a normal part of life. Maybe you're retired, your brain just isn't working as like it was at such a frenetic pace as it did when you were younger in your most productive ages. So you may have some memory loss, which we call normal memory loss of aging. And this isn't pathologic. This isn't because of any disease or anything. It's just a process. And there are different tools and techniques that you can do, like increasing your physical exercise, like increased cognitive exercises like crossword puzzles, Sudoku, word finding games, different things like that can help to increase this kind of memory capacity. The next category will be what's called mild cognitive impairment. And what mild cognitive impairment means is that the memory loss is out of the range of normal memory loss of aging, but yet it hasn't quite reached that threshold for what we used to call dementia or cognitive impairment. And even with mild cognitive impairment, you can have mild cognitive impairment from a number of things, from depression or hearing loss or sleep apnea, or mild cognitive impairment due to early Alzheimer's disease, or mild cognitive impairment due to vascular dementia. So it's a general term that means that there's some memory loss, but it hasn't quite reached a threshold where it is interfering with your daily life or interfering with things like what we call executive functioning, paying bills, taking care of the household, doing different things like that. And then the next category is cognitive impairment or dementia, and you can divide that into mild, moderate, and severe, and so forth. And when that happens, then we really start searching for a cause, or dementia or cognitive impairment due to what? Alzheimer's disease, Parkinson's dementia, vascular dementia, Lewy body dementia. I mean, it's a number of them we'll talk about today. But the point is that not all dementias or not all cognitive impairment is Alzheimer's disease. And there are different treatments, there are different workups, so we have to keep that in mind. So what happens with Alzheimer's disease specifically, Alzheimer's disease is a neurodegenerative process. It's a type of brain disease. You have this buildup of abnormal proteins called amyloid plaques and tau tangles that damage brain cells, and particularly brain cells that are in or around the hippocampus, around the memory centers of the brain, frontal lobe and temporal lobe. And with Alzheimer's disease, we don't know exactly what causes it. There are familiar causes or things that run in the family, certain genes that can make you more prone. We do think that the inflammation has something to do with it. Blood sugar, which causes inflammation, diabetes, so forth, can increases your risk of Alzheimer's disease. But this is a very specific disease. There are biomarkers both in the serum, like lab test biomarkers. There are imaging biomarkers like beta amyloid PET scans or tau PET scans that prior to a lot of these biomarkers, the closest we could come to diagnosing definitive Alzheimer's was by saying that you had probable Alzheimer's or highly probable, because it was a pathology diagnosis, meaning that the only way that you could tell somebody had definitive Alzheimer's is at autopsy. Now, after they've died and you actually do a biopsy of the brain and you look for these beta amyloid plaques and tau tangles, and you can say definitively they have Alzheimer's disease. But before, it was more of a clinical diagnosis of probable Alzheimer's disease. But now with the serum biomarkers that I mentioned, which are blood tests, and with the imaging studies like beta amyloid PET scans, tau PET scans, and even CSF studies now where you can actually do a lumbar puncture, which is a spinal tap, and look for these elevations in tau, elevations in beta amyloid. Now we don't have to wait until autopsy to make a more definitive diagnosis of Alzheimer's disease. So this is the most common cause of memory loss or dementia. But we can't forget about other causes. And, the next one I'll talk about is called vascular dementia. Most statistics have it as like the second most common cause of dementia or cognitive impairment. And the problem here is that there's a problem with blood flow going to the brain. And you can see this after a person has had one large stroke, meaning a major blood vessel like the middle cerebral artery or anterior cerebral artery has been obstructed. So you have a major stroke. Or it can be a stepwise process from what's called small vessel disease. And what small vessel disease is where you've had a lot of these little mini vascular insults. And, I order MRIs, and one of the most common calls that I get is, nowadays you don't have to wait to review your MRIs with your doctor. All this stuff is sent through your portal and everything else. And patients will call me and they'll say, man, what does this mean on my MRI? It says white matter disease and small vessel ischemic changes and all that. And essentially what that means is that, you've had these little small areas where there's been a temporary little blockage of an artery. Now, that could just be reactive from high blood pressure or high blood glucose from diabetes. There are a number of different causes that cause this buildup. And a lot of people have this. And typically it doesn't cause anything or cause any problems. But when you have a lot of small vessel disease, small vessel ischemic changes, then collectively it can cause memory loss. And it's more of a stepwise, meaning usually in Alzheimer's disease, you see just this gradual decline. But with vascular, it's kind of people will be doing fine, then they'll have an event and they get worse. And then they'll kind of level off again, then they have another event and they get worse. So it's more of what we call a stepwise decline. And the most important things that you can do to prevent further cognitive decline from vascular disease is, number one, controlling your blood pressure, making sure your blood pressure is under good control, that we don't see these huge spikes in the blood pressure that can cause these small vessel diseases or white matter changes. You want to keep your cholesterol under control, making sure there's not cholesterol buildup in these small blood vessels, which could occlude them and cause these things as well. Controlling your blood sugar level. If you have diabetes, high levels of blood glucose or blood sugar makes the blood very thick, sluggish, makes it very slow as it's going to these small vessels within the brain. And then smoking. Smoking, we know, smoking cigarettes damages the blood vessels going to the brain and can increase your chances of these small vessel disease. So doing those things, taking care of those things alone are treatment. I often will put people on a baby aspirin as well. They have a lot of this small vessel disease to try to help to prevent further buildup of these little small plaques. So the next thing I'll talk about is what's called dementia with Lewy body. And, Lewy body dementia or Lewy body cognitive impairment is a very devastating disease. It's a combination of memory loss or cognitive impairment and Parkinsonism. And I consider it really a spectrum from something else we'll talk about a little bit later called Parkinson's disease with cognitive impairment. But typically with Lewy body dementia, you see the memory loss and usually Parkinsonism or which Parkinson's is more of a motor type of disease, slowing of the mobility, shuffling of your gait, different things like that. And so if you have that and along with memory loss, then you can have or be diagnosed with what's called Lewy body dementia or Lewy body or dementia with Lewy body. Now there's a special type of abnormal protein that builds up with this called Lewy bodies. And the memory problems tend to cause things like fluctuating alertness. So a lot of people just blank out throughout the day or frequent naps, things like that. You typically see hallucinations with Lewy body dementia, usually formed hallucination, people, animals, different things like that. There's a high correlation between sleep disturbances, REM-associated sleep disorder, where they're acting out their dreams, and also the movement disorders, as I mentioned earlier, like Parkinsonism, so stiffness of the limbs, tremors, balance problem as well. Now, Lewy body cognitive impairment is often mistaken with Alzheimer's disease. Again, because unless you're a neurologist that's used to this, you may not see some of the subtle changes that are happening with the Parkinsonian type of symptoms that come along with this disease. So it's more of a reason why it's important to go in, see a specialist, and make sure you get the proper diagnosis. Frontotemporal dementia is another one, a very unique type of cognitive impairment. And, unfortunately, this type of cognitive impairment affects usually people a little bit younger, sometimes in their 40s or 50s. And it mostly affects, as in the name, the frontal lobe, which is right here behind the forehead, and the temporal lobe, which are on the side here, kind of behind the ear, which houses the memory. And the main thing with frontotemporal dementia is that you see a lot of personality and behavioral changes. You can see a lot of language changes as well. Inappropriate behavior, impulsive behavior, and loss of fluidity in the speech. Your frontal lobe, I like to say, is like your check system. It's the last part of the brain that develops, and it's the part of the brain that basically says, hey, it's not okay to do this, or this is inappropriate, or now is not the right time to do A, B, and C. So when you lose that frontal capacity because of neurodegeneration, you see a lot of impulsivity, you see a lot of behavioral changes, you see things that in patients that you never see. I've had people with high positions, deacons and pastors, that start doing inappropriate things in the church because they've lost that check system in the frontal lobe, so you see a lot of these behavioral changes within the patient. And when you see that, then that can sometimes steer you more towards frontotemporal dementia as opposed to Alzheimer's disease. And if anything that I've just talked about before isn't confusing enough, you can have mixed cognitive impairment or mixed dementia, where you can have Alzheimer's plus vascular dementia, or I've had patients who've had both Parkinson's disease dementia and Alzheimer's disease pathology as well. So this mixed pattern can make things very complex. Now, there are reversible causes of dementia, and part of this talk is that it's important to be able to figure out these reversible causes because they're reversible. There's treatment. For instance, normal pressure hydrocephalus, where there's a buildup of this fluid in the middle of the brain and the ventricles, and it can cause some memory loss, some Parkinson's type features, and then bladder incontinence. Now, the thing about normal pressure hydrocephalus is it's reversible. You can either reverse it by draining fluid, doing a spinal tap, or what's called a VP shunt, where they put in a shunt that drains the fluid from the middle of the brain called the ventricles. I've had cases where people had been misdiagnosed with Alzheimer's disease for years, and they came in to see me, and I'm like, well, why are they in a wheelchair? Why are they having so many problems with walking and urinary incontinence? And lo and behold, they had been just treated with Aricept, diagnosed with Alzheimer's disease. But you look at their MRIs, and they actually have enlargement of the ventricles. They have normal pressure hydrocephalus. Now, the problem with that is the earlier you make the diagnosis and the earlier you treat, the better their chance of actually making a meaningful response to treatment. And so if this diagnosis is misdiagnosed for years, then it makes treating it much more complex and complicated. So that's one of the main reasons why it's so important that we make the right diagnosis to make sure that we have the patient on the right treatment track. Other things like B12 deficiencies, very simple. B12 deficiencies can cause memory loss, and it's sometimes overlooked. I check B12 levels on pretty much anyone who comes into my clinic with any memory loss, and you treat the B12 and they get better. B12 serves as the food for the brain. And if you are either vegetarian or in different situations where you may not be eating a diet rich in B12, it is not uncommon as we get older to become deficient in B12. And so you supplement that either through subcutaneous injections. You can do intranasal sprays or sublingual tablets. There are multiple ways to get extra B12, and lo and behold, people get better. And then other things like thyroid disease, different things like that can cause memory memory loss as well. So when it's important to make the right diagnosis and make sure that we're looking at not putting or lumping everything under the purview of just Alzheimer's disease, because there is different reasons. And there are three big reasons why it's important to not lump everything into one category. One is treatment. I just talked about reversible causes like B12 deficiency or normal pressure hydrocephalus, things that can be treated. Also within Alzheimer's disease, making that definitive diagnosis, especially if it's early under the realm of mild cognitive impairment. We have these new treatments called anti-amyloid therapies. They're IV treatments that work really well, in my opinion. But you have to have a definitive diagnosis, and you need to make that diagnosis while the patient is still in that mild cognitive impairment state due to Alzheimer's disease. So there are different treatment options that can help patients, and even when it comes to vascular dementia or vascular cognitive impairment, managing risk factors like blood pressure, like diabetes, smoking cessation or stopping smoking. These things have a profound impact and can have a profound impact on a patient's life. The second big thing is prognosis and planning. All of these different entities progress differently at different rates and have different effects on a person. So when you think about Alzheimer's disease, which typically just steadily if you do nothing, it just steadily worsens over a number of years. Vascular dementia can stay stable for a long period of time, and if you treat those risk factors like the blood pressure, blood sugar, cholesterol, then a person can do well and you don't see any further decline. But then you look at something like Lewy body dementia, which has a much worse prognosis and can decline much faster, that in frontotemporal dementia. So when that happens, you need to have a higher level of things like family planning, talking with family about important things like dual power of attorneys, living wills, estate planning, different things that you need to take care of now while you have the cognitive ability to contribute to those decisions. And, that can't be understated enough. I've unfortunately been involved in different family disputes, even from a legal standpoint, as neurologist of a patient, where once a person is not able to make those type of decisions for themselves cognitively because of their condition, all types of things can happen. And I've had to write letters on behalf of patients' families, and I had one patient that was taken advantage of and actually moved to another state by his, girlfriend/wife. But the point is that it's important to know how these things progress and at what rate and what types of things do they affect. Like if it's frontotemporal dementia and it involves impulsivity, then maybe that helps to explain some behavior if it comes to overspending or different things, so we can now as a family make sure that we have those things under control. So that's what I talk about when it's important as far as family planning and prognosis. And then the last thing would be healthcare costs and of course, wealth protection. Mistakes in diagnosis or misdiagnosis can lead to a number of unnecessary tests, ineffective treatment, and missed opportunities for prevention. And early detection in things like reversible causes or treatable causes like vitamin deficiencies or thyroid problems, which I forgot to mention earlier. Thyroid can also cause memory loss as well. This is a missed opportunity and can lead to a lot of healthcare costs later on down the line for that patient and their family because of this misdiagnosis earlier. So those are a couple of different reasons or different things that we can do, or why we need to make this diagnosis and get the accurate diagnosis when it comes to memory loss or cognitive impairment. So what should you do? What are some of the warning signs that you should look out for? You might be asking, well, you've said a lot of things, you've gone over a lot of things. I know that my mom or grandmother or loved one or whatever, husband, wife, is having some memory issues, but where do I start? How do I even start figuring out, if this is normal memory loss of aging or if this is something pathological? Because I want to intervene early. I want to find out early what this is. So, different things that you want to watch out for. And, in the end, I always say, get involved with a good either primary care physician or a neurologist if you have access, if you have any questions. I see a number of patients who come in for memory loss. Either they have a family member that has it and they're just afraid. And through my battery of testing and different things that I do, I can just reassure them that, hey, there's nothing that I'm worried about right now. And you don't have a cognitive, but that in itself is therapy, because now that person isn't worried anymore that anytime they misplace something or can't forget, who's their favorite character in the movie, they're wondering, oh my God, do I have Alzheimer's or am I falling into Alzheimer's disease? So I see people that come in for assessment and reassure them. And, the same advice to them I'll give to you right now. The things that prevent you or can slow the progression of memory loss. Number one, physical exercise. Just get out and exercise. Increase blood flow to the brain. Your brain is one of the organs in the body that use up the most energy because we're always thinking. And so the more energy, blood flow you can provide to the brain, the better you're going to be. Number two is neurocognitive exercises like crossword puzzles, Sudoku, word finding games, just different things to engage your brain. When people retire, sometimes they slow down their brain functioning so much that the brain's like, oh, well, it's conservative. If you don't use it, you lose it. So you have to stay active socially, whether it be in church or civic organizations, community organizations, whatever, volunteering. Just keep your brain going. Keep your brain going, and that will preserve or keep you from going into memory loss. Certain vitamin supplements like vitamin D, vitamin B12, fish oils, these different vitamins that we help our body can help your memory loss. Making sure that you take care of other problems like high blood pressure, and especially controlling your blood sugar level. There's more and more evidence coming out about this correlation, this connection between high blood glucose and memory loss and dementia. So some of the things to look out for are, repeated memory lapses for daily tasks, things that someone has been known to do for years, and all of a sudden they're having problems doing that. Getting lost in a familiar place is a big thing. I'm always asking about driving. And nowadays with GPS, to be honest with you, I use my GPS to go everywhere because I'm looking for traffic and accidents and everything else. So I do overuse my GPS because as I tell my patients, look, I want you to think. So I want you to remember how to get to these places where you go frequently. But I even overuse my GPS. But getting lost in the neighborhood, forgetting where to go to these common places that a person's gone through, that should raise some flags as well. If you see things like trouble handling money, lapsing in bills, or missing medications, that should be a red flag. Scams or frauds. Just last week, I had a family that brought their loved one in to see me, and this person was living by themselves. And the thing that really got the family to bring them in was that they had been scammed, not like once, but like twice, by the same company, giving money to this charity or doing this. I've had people who have had their roof replaced like 2 or 3 times in a row by companies when they didn't even do anything. Unfortunately, it's a black market in the industry now to take advantage of patients and elderly patients with cognitive impairment and dementia. So when you see those types of things, it could be something going on as well. And then personality changes, unusual behavior, impulsivity, different things like, he's never gambled before, all of a sudden they're gambling and impulsively spending. That could be a sign of cognitive abnormality. So don't just accept that this is just memory loss or, maybe they have Alzheimer's. Go in and get the appropriate workup and in order to figure out what's going on. And in general, do those things to just take care of your body. I've said them several times, and there are even podcast episodes that I've done about it. Exercise your brain and your body every day. Find a time to just work some word puzzles, Sudoku, word finding games, things to exercise your brain. Protect your cardiovascular health. Take care of your blood pressure, cholesterol, because all of those things protect the blood vessels going up to your brain. Smoking is toxic for the brain. Too much alcohol is toxic for the brain. Keep all those things under control, and what you'll find is that you'll be able to help keep your brain highly functional, staying engaged, and hopefully prevent some of these things that can cause memory loss or cognitive decline. So when you know the difference, you protect not only your mind, but you also protect your wallet from unnecessary healthcare costs that can be associated with mixed diagnosis and underdiagnosis as well. So I hope that you have enjoyed this episode. If you found it helpful, share it with others, like it, and I appreciate being here to be able to bring you this information. This is your host, Dr. Eddie Patton, and I am signing off of this episode of Your Health, Your Wealth. Keep staying healthy, sharp, and protecting yourself. And remember that not every type of memory loss is Alzheimer's, but if you do feel as though you're having any type of memory loss outside of normal, then go see your physician, go see your primary care physician, or even a neurologist to get the proper workup and assessment. Thanks again for tuning in, and tune in for future episodes of Your Health, Your Wealth.